All right, hello
Hello.
everyone. My name's Dr. Hammer, and we are doing our first ever Facebook Live event here from our clinic here in Spanish Fork, Utah.
My name is Lindsay Leonard. I'm a nurse practitioner here in the clinic, and we're excited to talk to you guys all today.
So we're going to have a couple rules on how we do this. We're going to do a presentation, and then we hope that you all ask some questions. If you want to just put it in the comment section, and then at the end of our presentation we will try to answer as many as we can. Try not to ask for personal medical advice. Now, we're both doing this because we like metabolic health. We like to help people lose weight, how to treat their diabetes, and we just feel that everyone can get feeling a lot better if they follow these principles. So we get a lot of people coming into our clinic. They're having troubles with fatigue. They're feeling like they're overweight. They're having aching joints, foggy brains. And these symptoms may relate to them having something called metabolic syndrome. So if you have 3 or more of the following conditions, you may have metabolic syndrome, or you do have metabolic syndrome. If you have a large waistline, for men and for women, there's different inches there. If you have a blood pressure of 130 over 85 or higher, or if you're taking blood pressure medications, if you have a high triglyceride level, an elevated fasting blood glucose level, and a low HDL, which is a low good cholesterol. And so for a lot of people, this problem is significant. Only about 1 in 15 Americans are truly metabolically healthy. Lindsay's one of them. We just tested her, and she is.
Just did my lab test. Yeah.
And if you're not metabolically healthy, as you can see on this slide, it can contribute to a lot of health problems. So let's talk about this, Lindsay. A lot of people, the problem can be found with a simple blood test, which is often not ordered.
Yeah, so you may come into the clinic and get your lipid panel done, or just a blood count, or even an A1C checking for diabetes, but there's even a better test that we can order. So what is that test?
Yes, it's called a fasting insulin level.
And what does that show? So when the insulin level is elevated, it's often a sign of insulin resistance. And insulin resistance is a key player in the metabolic syndrome that we were talking about earlier. So people that have insulin resistance, they often also have high triglycerides, low good cholesterol. So you can see that on the lipid panel. They'll have an elevated hemoglobin A1C, that's a diabetes marker, and they might even have signs of liver inflammation or fatty liver disease. So we're going to talk more about what insulin resistance is and how this happens.
Okay, so I have a cheesy analogy that I share with my patients a lot and the students that I teach, so hopefully this makes sense to you. This is you. You're the player in this, and you have 2 important organs that are also important, your stomach and your pancreas. So first of all, you need to know that the pancreas produces this very important hormone called insulin. And in this analogy, insulin is the mailman. The mailman is the deliverer. Insulin delivers mail, or delivers sugar, to all of the cells of our body. The mail is the food that we eat. The food comes into our stomach. It's broken down into glucose, and glucose is that mail. So we have insulin receptors on all parts of our body, really in all cells of our body, including our muscle, our brain, eyes, and heart. And there they are. We have these receptors, which are the mailboxes. That's what receives the glucose from the mailman. Now, when we eat junk food day in and day out, this causes problems. As you can see here, there are receptors on all of the different cells on our body, but the more carbohydrates we eat, the fuller and fuller those mailboxes get, and they can only take so much. And so they say, we're done. We don't need any more junk mail. And this overwhelms the mailman. He gets tired, got too much mail. So just like what's coming up soon, the holiday season, when we're drowning in mail or drowning in too many carbohydrates, what do? Well, a whole bunch more mailmen come. So these are the temp guys to deliver all the extra mail. And in our bodies, this is an increase in insulin. So the body's response to excessive carbohydrates is more and more insulin, which can lead to problems. So insulin resistance is when all of these cells in our body say, we're done. We can't take anymore. And again, with the excess of sugar in our body, the mailmen are just getting burnt out. More and more mail, more and more insulin. Now, people wonder, why do they get larger? Why do they gain more weight? Well, the real reason is fat cells are hoarders. I think we've all met a hoarder before. They actually like junk mail. And fat cells are the same. They'll take as much as we can give them. Fat cells are storage cells, so they'll take the excess sugar and store it. So there it is, all the mailboxes full on our fat cells, continuing to grow fat. Is that all right?
Mm-hmm. Okay, so the main gist of that is excess carbohydrate ingestion over time leads to high insulin production, and then that leads to many health problems, including obesity and type 2 diabetes. So the problem is insulin resistance, and then it leads to all these other health problems. Okay, so the foods that are most likely to cause insulin resistance are processed carbs like flours and sugars. They're pretty much everywhere. They're in most of the foods that we eat. It's interesting because, so cane sugar there has 200 grams of carbs per cup. And that's not too many, but the average American eats 60 pounds of sugar per year. That's a lot.
A lot.
And to put this into context, if you're really working to improve your metabolic health, get rid of diabetes, other stuff like that, the literature actually recommends less than 40 grams of carbs per day. So per cup of sugar, that's, more carbs than you should be eating over 5 days.
Like a fifth of a cup.
Yeah, exactly. And then flour, you might look at that and think, oh, it's not as bad. It's only 95 grams of carbs per cup, but look at how much we eat per year. It's over double, so 130 pounds per year. Other culprits include rice, potatoes, sweetened beverages, fruit juice, and any other foods with added sugars. So they cause problems because they cause high spikes in our blood sugars and then subsequent spikes in insulin release from the pancreas.
All right, so many people ask us, well, Doc, I've been eating wheat and rice and potatoes all my life, and they're supposed to be good for us, those foods. And we're told to eat 6 to 10 servings of whole grains every day. So aren't they good for us?
The short answer is no, and yes, we have been told that over the years. But you can see over time in America that as we have decreased fats in our foods, and then in turn increase the amount of processed carbs to make the foods taste better, that there's been a direct correlation with the cases of obesity and metabolic syndrome. So here's a diagram that shows that. You can see exactly when the low-fat diet recommendations were put into place, and then the percent of obese Americans that followed.
Yeah, it's going up a lot. So, why is insulin resistance and obesity so bad?
So like we said, it leads to many other health problems, and some of them you might have heard of or you might see with people in your lives, but some of them aren't as obvious. So insulin resistance, that leads to obesity, like we said, fatty liver disease, type 2 diabetes or prediabetes, hormone imbalance, body inflammation, and then it's also been linked to Alzheimer's disease, many cancers, and heart disease. So you can see here cancer of breast, colon, pancreas, arthritis is another one on there. Really, so many health problems come because of this.
So even increases your risk of cancer.
Yeah, it's crazy.
Okay. So, all right. We love carbs though. They taste so good. How can they be so bad for us?
Yeah, it's interesting. When you eat stuff that's high in carbohydrates, it stimulates a dopamine response, and we get that quick blood sugar rise. So when we get that dopamine response, that's what causes things to be addictive. We really do have an addiction to carbs in our country. Our brains and our cells, they love it so much initially. That's why we call them comfort foods. They just make us feel really good. But the problem is they've been processed so much and they lack nutritional value. So this leads to a higher addiction potential, and then we often overeat carbs because they aren't able to make us feel as full. Or that's called satiety. We talk about that a lot with fats and carbs. So when you go to a buffet, you eat more and more carbs, but then a few hours later you might notice that you're hungry again. Your body's not satisfied. And the people who market foods, they know this. The foods with the healthy fats, they aren't very addictive, so those aren't marketed as much in our country. The foods with the simple carbs, they're very addictive, so they're marketed like crazy. Even worse than that are the foods with simple carbs and added fat. So think about donuts, ice cream, giant cookies, lattes from your coffee shop, sugary sodas with syrups and creams. Those are highly, highly addictive, and we feel good when we eat them. But why don't you tell us about other factors that have contributed to America's overconsumption of carbs?
Yes. So most of us have been trained as children on certain eating behaviors. I don't know about you, but for me it was you have your cereal and your skim milk for breakfast because skim milk's better for you. We have our sandwich for lunch and our pasta for dinner. We were taught that this is the way, Mandalorian, this is the way to eat. Three servings or 3 meals and 10 servings of grains every day. And they're ingrained in us, literally. We've also created bad habits. So we reward ourselves with food. Like if we've had a hard day at work, or if something emotional happens in our lives, we reward ourselves by allowing high consumption of sugary foods. And this is not healthy behavior. It's not good in any way. The last thing is that we get in a cycle of worsening insulin resistance over time. So I'm going to show you this diagram. At the top there's somebody eating a high carbohydrate diet or a high carbohydrate meal. This almost immediately causes a spike in blood sugar. And as we discussed earlier, the pancreas produces insulin. And that insulin takes that sugar and delivers it to the cells. And the cells over time become resistant, as we talked about. So now over there on the left, we have a person who's just 2 hours ago eaten a high carbohydrate meal. They are not satisfied. Their cells are starving for actual nutrition. Their insulin levels are high and their glucose levels are high. And then they're tired. They just feel crummy and they think, oh, I need to get something else in me. I need to go get my caffeinated beverage, or I need to go get a spike of sugar again. And then the cycle continues.
So what can be done? How can we all work on stopping this vicious cycle?
So it's great. And this is something that I think is just continuing to be new information for everybody, and it's learning how our body works and what insulin's role is in all of this. Insulin is a storage hormone, and with high levels of carbohydrate consumption comes high levels of insulin, and this leads to fat storage, inflammation, and fatigue.
So another thing that we see in our clinic that we wanted to talk about is the people who really want to lose weight, but they say that they can't. They've tried everything, but it's just not coming off.
Right. So many people have tried different weight loss options, and even some have lost weight but then gained it right back. It's a common thing that we hear. And they might even say, I have just been drinking water and eating lettuce every day, and I'm not losing any weight. And I'm going to do another analogy for you about the gas tanker that I learned. So here comes the gas tanker. Our bodies are like this. We've probably seen these driving around. There's a whole bunch of gas in the large tank, but each tanker also has a small tank that it runs on. That's its fuel. Well, we can't access all of that stored fuel when our insulin levels are high. So the only way that we can access this stored energy, and we're talking about hundreds of thousands of calories of energy that are stored, the only way that we can access that is through lowering our insulin levels. And the only way we can lower our insulin levels is by decreasing our carbohydrate consumption. This is energy for our bodies. So just like a tanker truck empties its gas at the gas station, we can release all of that stored energy. So I have many patients who do simple things like stop drinking sugary drinks or decrease their portion sizes on their carbohydrates, and they'll pretty quickly start losing weight. It's pretty fun. A more intense approach would be a ketogenic diet where the body has very limited intake of carbohydrates and is completely dependent upon fat for energy. And that's one thing we do a lot with our patients, and it's very successful.
Mm-hmm. Especially with our patients with diabetes, we've seen a lot of cool success stories.
It's awesome. So just to reiterate, I'm going to read this slide to you. The most effective therapeutic intervention for insulin resistance and metabolic syndrome is this: therapeutic carbohydrate restriction, also known as low-carb, healthy fat diet. And I want to emphasize on this. This is not the fad diet that you see on Facebook or on Twitter or any of the websites. This is therapeutic. It's guided by a medical provider.
And with most of our metabolic states, it's taken time to get there, and it's also going to take time to reverse it. It's like we said, it's a long-term lifestyle, not just doing something for a few weeks. And this sounds so easy at face value as we're talking about it, but it's way harder than it actually sounds. So for many people, we believe the first step is just knowing what they're supposed to do. Knowledge is definitely power in this situation. And then also simple changes, like Dr. Hammer talked about, drinking less sugary drinks, decreasing portion sizes, those can make really large impacts. Another thing that we recommend is to stay away from the inside aisles of the grocery store. If you look at the outside edges, that's where the vegetables, the fruits, meats, eggs, and dairy products are. Really try to stay away from the processed stuff that's in the middle, and then try to eat real foods. Buy those foods that don't have labels on it. It doesn't have to tell you what it is, it's just the real food. We also need to change our thought process that fats are bad. They keep us fuller longer, they don't have as much of a response with our blood sugars. And just remember that if a product says that it's low in fat, it's almost always high in carbs because they've had to substitute the fat with something to make it taste good. And we've seen from that graph before, it's actually the carbs that are making us fat, not the fat.
Yeah, couldn't stress that enough. It's the carbs, not the fat. So, what do you do if you want to make a step in the right direction with your metabolic health? So first, go to your primary care provider and do a metabolic health checkup. Most, if not all, insurances will allow you to get a physical and get your fasting labs checked. Ask them specifically to do a fasting insulin level on you. Get a cholesterol panel, get an A1C check, and look for providers in your area who are a part of the Society for Metabolic Health. There's a good website for that on the internet. This is a worldwide organization that promotes longevity and overall healthy metabolism. We also highly recommend watching this free video called Fat Fiction on YouTube. Great information for patients, and all the people that have watched it have really liked it that I know of. 3 more resources are these books, 2 of them written by Dr. Jason Fung, The Obesity Code and The Diabetes Code. I believe if anyone out there has type 2 diabetes, they should read that book, The Diabetes Code. And then lastly, the book Why We Get Sick, written by BYU professor Ben Bickman. Now, let's share with you one other thing. Lindsay and I have teamed up with a company called Restore Health. It's a kind of all-in-one package. It's an app that is combined with Low Carb USA to help give you easy to follow instructions. So there's a live health coach that you're assigned to that you can communicate with. It's very easy to use. You take a picture of what you're eating and you get feedback from your coach. The curriculum is personalized for you, and it focuses on the 4 pillars of health, because we know it's not just about eating.
Mm-hmm.
It's about sleep and about stress and all those different things. So if you're interested in that, please look into signing up. So remember, we're not talking about doing a fad diet. We're talking about a lifestyle change. And we have many of our patients in our clinic who have decided to go against the standard American diet. Just stand up, make a change. They're doing so well. They feel so much better. They don't have insulin resistance, and some of them don't even have type 2 diabetes anymore. It is awesome. They're off their blood pressure and cholesterol medicines. They don't have as much inflammation in their body. They have lost weight. Their risk for disease has decreased. And I need to stress that. It's not just about losing weight.
Mm-hmm.
It's about reducing burden of disease. And this is something that most people can do with the right education and resources.
Well, thank you all for attending this and listening. We're really passionate about this subject, as hopefully you could tell. And yeah, please reach out to us if you have any questions. We've seen a lot of success with some of our patients, so we really felt like we had a mantle of responsibility to bring this information out to other people. And we'll open it up for questions now.
Oh, good. There's some questions. Awesome. Okay, so let's look at these.
Okay, so first question, I'm curious, with the therapeutic low-carb diet, is this also something that can be helpful with cholesterol? And yes, it definitely can. It's something that will take a little bit more time to resolve, but we have seen some of our patients be able to come off of their cholesterol medications because their triglycerides go down and their good cholesterol goes back up. So that's been really cool to see.
And it is. People are so amazed that they say, well, I'm eating more fat. Shouldn't my cholesterol go up? Most of the time, if they're doing it correctly, their cholesterol actually goes down. So, well, thank you, everyone. We hope you enjoyed this and have a wonderful day.